Get started again. Just a little bit of information for the audience, but certainly the panelists are already aware of this. The whole point of the evening is to inform the voters, and to that end then, questions may not be specifically for both sides to answer, they may just be for one side to answer. If that's the case, that side will get 2 minutes to answer the question, and then the other side will get up to a minute if they want to input anything on that question. If the question is for both sides, then they each get 2 minutes to speak. So again, panelists, if you need the whole time, take the whole time, but if you don't, then certainly we can get to more questions. So that's what we will do. And also, unfortunately, we only have one microphone for all 7 of us. And so, Sam, first question is to you is, finish your questions about the assets during the transfer, being transferred. I believe the question is, please finish your questions about whether the assets can be transferred.
Right, the comment has been made that we could just transfer the assets from the hospital to this newly formed entity. And making that assumption ignores the fact that the hospital district is a separate legal entity from the county or from any other private organization, and we have to satisfy our creditors. Currently, we owe $1.6 million at the end of the year to our bondholders. They're waiting anxiously to see how this plays out. We'll have to satisfy using the assets how we can pay off those creditors before we can just wheel it across town into the new organization. The other thing that I was commenting on was that this organization hasn't been formed yet, so that's a question about who it would be transferred to. I guess there's some statements made that it might be the county, but the county has indicated that they're not willing to be a hospital, or that they're not willing to go in that direction.
So everybody has to remember that this is a community plan, and we're not suggesting that St. Vincent close. We're not suggesting that St. Vincent's not be there. I think it would be easy for us to imagine that if we all worked together as a group, we wouldn't have to have St. Vincent's close. We wouldn't have to have them sell off their assets. And if we can find another financially viable solution where we all work together as a community, they wouldn't have to close their doors, there wouldn't have to be any transferring of assets, and St. Vincent's would not have to close their doors.
Lisa, that your proposed facility as an emergency room will not be a part of a hospital. I understand that such an emergency facility could not take Medicare if it were not part of a hospital. Is that correct?
So again, I'm repeating myself. I'm not asking to start a whole new institution. We're not asking to apply for licensure separately. We're not making the Dr. Lisa Hospital. What we're doing is we're providing a community facility that will allow access for all individuals into that emergency room. And I'm hopeful that St. Vincent's will also come to the table with us. They will also be part of our solution, and that they will also be part of the licensure, which will allow us to continue to be able to accept Medicaid and Medicare. All of you know that in my office, I currently accept Medicaid and Medicare, uninsured, insured, everybody. And that would not change. The urgent care setting would not change. And if St. Vincent's is willing to be part of our solution, then of course we'll be able to take those assets as well.
I guess that may be part of the confusion that maybe triggered the question is the lack of clarity in the plan that's been presented. The fact that we don't really understand who the entity is, if it would be the hospital, a county facility, or some public-private venture. I think that might be the basis for the question to begin with.
Okay, the next question says, Dr. Zwerdlinger has stated that the possibility of a public-private partnership exists. She's determined that an ER can be built and equipped for $2 million, and that her analysis of the operation indicates it would be profitable with no taxpayer support. In the interest of full disclosure to the potential partners, the public, please provide the analysis that supports these claims.
So the proposal, or the alternative plan that was put out there, suggested that there was a public-private partnership between all the entities who were interested in Lake County, that there would be a development of a facility that would be able to take care of emergency services, ambulance services, primary care, and urgent care. And what we're proposing with partners in our community, and obviously Climax is sitting next to me, so that's one of them, we are hopeful that Centura will also continue discussions. St. Vincent's would come to the table. All of the other entities involved would be able to build the new facility that Sam alluded to, maybe just on a smaller scale, and that financing would be secured through those methods.
All right, the next question is for the Save St. Vincent side. It says, if 1A and 5A pass, will you be back in 5 to 10 years or more?
Probably not. I mean, the review process at our plan must go through. The preliminary stages of it have been reviewed with USDA, with Janice Pond, who was in the room. It has to be reviewed by 2 outside consultants. One is Stroudwater Consultants and the other is Ide Bailey. We have to go through a double review process in order to get that loan approved with the USDA. So before anything would be finalized, these numbers would be reviewed more thoroughly than any other study that I have had done before. So the numbers are stated conservatively, and I believe that they'll be reviewed comprehensively by those 2 entities before anything is finalized. So I would anticipate no, there would not be an increase.
My comment would be on the contrary. Sam's plan that we've all seen shows that in year 5, after 1A and 5A pass, year 5 the hospital turns a profit greater than 5%. When that happens, we start returning, we start paying down the debt, I'm sorry. And so we don't need to increase taxes because we'll be in a favorable position at year 5.
So over the past several years, when we've talked to St. Vincent, we've said that you need to make sure that your plan is sustainable. It's been over the last 5 days where we finally were able to explain how mine by proceeds work. And in the calculations that they were doing, they were assuming that property taxes are stable like they are with the residential that you're all paying, and you're understanding what you'll pay residentially. But when 83% of the taxes that are paid by Climax Mine are on the personal property and mine by proceeds side, that makes that much more variable, so that's not a steady stream of income. So it really needs to be considered that this plan needs to go forward without considering Climax Mine tax dollars. That doesn't mean that Climax won't be at the table and invest into the right plan. It's just that if something happens in year 2 or 3, then this plan has already fallen on its face in year 2 or 3. So we need to make sure this is sustainable with or without Climax dollars, or we won't be able to continue the financing.
This next question is addressed to a better plan for Lake County. It says, St. Vincent's must provide care to the indigent patients in need. Low-income indigent folk are a large percentage of our community. In the absence of the hospital, does Rocky Mountain Family Practice have to treat the indigent? What other plan is there for these members of our community?
In 18 years that I've been here, I have always accepted Medicaid, Medicare, insured, and the uninsured. I have a sliding scale that I offer in my office that was developed through the Public Health Department. And that there will be an agreement between Rocky Mountain Family Practice, if we're chosen as the people who will staff this new facility, and whoever manages the facility, that we will continue to accept all comers. We will not turn people away. What's interesting about Rocky Mountain Family Practice, which is different, I think, than many other rural healthcare clinics, is that we enjoy a large percentage of our patients as insured. And that because we have a large percentage of patients that are insured, we can financially support seeing patients who are not.
Okay, this question is for St. Vincent's. It says, St. Vincent Centura has just announced that they are investing $11 million in Avon, Colorado in Eagle County. Centura recently bought out a doctor's group in Summit County, Colorado. Why are they investing no money in Lake County, Colorado?
The difference is that the other two the locations are owned locations by Centura. Here in Leadville, Centura has been here since 1993, by the way, further than anybody else I know of. When I came to the table, my first venture in 1996, Bob Wallace Centura was here. There's been a strong commitment to this community and has been ever since. In the plan that was submitted to the board in January, there were indications that there would be an option for a long-term lease, potentially a purchase of the facility, but we would have to get past this election. There needs to be, first of all, support of the community. It needs to be a viable concern. At that point in time, a future year down the road, maybe 2 or 3, Catholic Health Initiatives would consider buying the facility and putting money into it, but currently they do not own the facility here. It's simply managed. Within that context, we provided free services to the amount of $200,000 in climbing to make this a go in this community.
So again, I want to remind you, this isn't one plan versus the other plan. But we did have a conversation with Centura, and their answer to that question was that it's about return on investment. But it does make me wonder that if there's going to be another clinic 40 miles away, and there's one in Summit County, and most of our employees, or most of our residents are employed in other counties, we're just creating more competition for what might work in Lake County with an entity that's not willing to invest dollars here at this point. Climax is willing to invest dollars in the right facility at the right price at the right time, and we would challenge, maybe a challenge grant with Centura that we both need to be putting money into something capital so that the taxpayers aren't burdened with a variable tax base going into the future. So I think that's all.
Okay, and this question again for the A Better Plan for Lake County side says, what plans are there for providing preventative, preemptive care to deal with many of the chronic health care issues that are major issues in Lake County, like cardiac care, substance abuse, diabetes, obesity-related issues?
So welcome to family medicine. That's a fantastic question. Family medicine, as you know, is what my specialty is. It's what I'm boarded in. It's what I've practiced for the past 18 years. And certainly one of our enormous focuses is preventative health. And those of you who are patients at Rocky Mountain Family Practice know that we do all of preventative health. We are a current certified medical home through the federal government as well as the state of Colorado. And the primary focus behind that designation is to make sure that we are a medical home for preventative care. We do obesity counseling, smoking cessation counseling. We counsel a lot for sexually transmitted diseases, being so close to college. We also do a lot on obesity prevention. We certainly do our share of diabetes treatment, hypertensive treatment, and then maintenance of cardiovascular disease. So certainly your family doctor here in town, as well as all the other people who practice at Rocky Mountain Family Practice, are well versed in preventative health care, and those services, of course, would continue.
This question is for Gail. Can the ambulance take a patient to a freestanding ER?
Yes, they can, actually. There aren't very many freestanding ERs. Most of them are in an urban area. And so down in an urban area, we may have a freestanding ER, but the majority of patients that are going to them are ones that self-deliver to those locations. The ambulances have hospitals to go to, so that's where they tend to go. One of the distinct differences may be that we have a state trauma system here in Colorado, and that actually makes a requirement on EMS that if they have patients that meet certain criteria for being severely injured, that they be taken to the closest hospital that's designated to provide trauma care. So they would not be coming into a place where there's not a hospital. Now that might depend. You could find yourself in the middle of a snowstorm at your clinic with the hospital, with the ambulance needing to stop, from a bad car crash, and I don't know what the readiness would be in the emergency department. Know that to provide emergency services in a facility, you actually have to be licensed, and you have to meet state building codes and state life safety codes, facility design standards, etc. So there's a number of things that need to go into that facility type, as well as then an expectation of what care you're going to provide. So I don't know very many of the clinics that are involved in airway management, that are doing chest tubes, that are doing some of the things that are life-saving. But yes, they can go to the clinic.
Your response to this, huh? Sure. Over the past 18 years that I've been in Lake County, I've also staffed the emergency room, as many other very qualified providers that are here in the room with us today. And that all of us are qualified to take care of emergency patients. We do airway management, we do chest tubes, we do all of those things.
In your office?
No, and in no way do I suggest that any of those things are done in our office. And currently, right now, when I have a critically ill or injured patient that presents to my office, I dial 911 just like all the rest of you do. The ambulance comes, picks them up, and they take them to a qualified facility. Our plan is that that will continue, and we are hopeful that St. Vincent's will be part of that plan.
This question asks, how many tax dollars are being used to pay for the campaign activities for the Save St. Vincent campaign for the past 24 months? Again, how many tax dollars are being used to pay for the campaign activities over the past 24 months?
0.
This question asks, where will Dr. Zwerlinger get her staffing, and where will she get funding for a new building with a tax-free plan?
So I will get the staffing, I will hire them as I do the current staff that I have. The plan, as again, we've addressed here before, will be supported by a collaborative effort by multiple levels. If you're asking if I have an exact plan, if I have a financial spreadsheet, you know I don't, and that's not where we're at right now. What we are asking for is to vote no on 1A and 5A to give us more time to develop that plan. Obviously, we have agencies here in the room with us, at the table with me, who are willing to be part of that financial effort.
Well, when we say a better plan for Lake County, when Climax became involved in this campaign, we meant that a better plan. It doesn't mean that we don't want to be working with Centura. It doesn't mean we don't want to work with St. Vincent. It doesn't mean we don't want to work with Rocky Mountain Family Practice. It means that we care about the health of all of you here. We care about emergency services and transport services for every single person in this room. And we all need to come together to make sure that we can have the right plan. My mother used to say, don't drink champagne on a beer budget. Right now, we need to understand what our budget is, and we need to be able to provide champagne if we can afford it. But if not, we need to make sure that each and every one of you is cared for, and we're all at the table together, and we're building the right plan, not being forced into closure or spending lots of money over 25 years that may not be sustainable. We can create the right plan, and all of you can win, and we can all get together when this is over November 4th and say, this community has done the right thing for each and every one of us, and we can build something that everyone in the nation and rural communities can be proud of as far as collaboration and caring for their citizens and caring for the health of their citizens. And every one of us should be committed to that.
Dr. Lisa said that she doesn't have a spreadsheet showing financial viability, and that's not where we are right now. But that is where we are right now. Centura has been working on that plan for 4 months. They came up with a good plan, or they came up with a plan. They presented it, and we certainly are at that point. As far as coming up with a good plan, we've been doing that. We've been doing it for the last year, and so it's not something new that we just started recently.
Because we're getting down to just about 5 minutes left, I'm going to combine a couple of these questions. It says, if 1A and 5A fail, what do the citizens of Lake County do then, and how long will it take? And also, then, will Centura walk away from our community if these middle of these fail?
Well, since they want the issues to fail, maybe they should answer the question, what happens then? where do you go to have a licensure?
So again, we're not suggesting that there are no emergency services. That's not what we're suggesting. Sam has told us that there's money in the bank, $1.6 million that he's anticipating at the end of December. The hospital doesn't have to close on November 4th or December 31st. The hospital can use those resources to continue services until facilities are available. There are people in the community who are willing to commit to that financial end. For example, Rocky Mountain Family Practice would staff that facility if asked. Rocky Mountain Family Practice would take that cost. We wouldn't ask any supported money from the hospital. If the mill levy fails on November 4th, we already have mechanisms in place to continue this discussion. Last year, when 5A failed, and I did support 5A last year because I was terrified about that exact question, and we had no alternative plan. Our hospital was closing and we were all desperate. So if 1A and 5A fail now, we're not going to be caught like that because we have facilities in place. We have a plan started to be able to start those conversations.
If both of these ballot issues fail, it sends a huge message to those other stakeholders involved. It says that you're not willing to contribute $100 as taxpayers to make it survive. This plan that we have presented is Centura's best plan that we feel is most viable. It's the best option. It doesn't put too onerous of a burden on any one entity. We believe it's the best plan that can be there. We'll continue the dialogue as we are talking now, even with the mine and others. We'll continue the dialogue through the process. But our bondholders are watching anxiously at what this picture looks like. We tripped the bond covenants over a year ago. I meet with the bondholders monthly to update them on what Centura is doing to manage this facility. And they're satisfied. They have the authority right now to come in and put a management consultant in place to run this hospital, to protect their investments. They have elected not to do that because they're comfortable with my management expertise and that of Centura. They're satisfied that we're doing everything that can be done to meet the needs of the community, put forth a plan that works, and to protect the bondholders.
Thank you. This question states that the Better Plan for Lake County calls on the county to take over the ambulance taxpayers will occur. How can the county provide the existing level of ambulance service with no additional taxes? Please specify the dollars that are committed and for how long before a mill levy increase would possibly be required.
That's a really long question.
So trying to understand what the actual ambulance cost is has been incredibly difficult. I mean, I don't know how many in this room think they know what that number is, but I've seen at least, thank you to all of you. I've seen several numbers. I mean, last December we saw numbers that it was $262,000, and recently we've seen that it's $750,000. We're trying to understand that number. In fact, we're trying so hard that we've submitted a formal request to try to understand those numbers, so that if Climax needs to be a part of the solution while a better plan is being built, we know what that number is and we can participate in that solution. So again, it's really understanding that ambulance service is a model that probably does need to be tax supported. But what is the level of tax support? And in an all hazards district, you know, there's talk that that's not really a thing. Call it whatever you want, but there's lots of models for running ambulance services, and I think we all need to be exploring all of those, not just one entity. And if the county were going to take on ambulance service, let's bid it out and figure out what it costs. If we're going to contract it with someone else, let's understand what that costs. Let's look at the national models. We've got counties right next to us that are using fire service and ambulance service in combination, so that's more efficient and a model that can work. So I don't even know if that answers the question, but I think we just don't even know what it costs. We need to understand what it really costs and what the most efficient model looks like if we're going to have ambulance service. Is it $262,000 or is it $750,000? And I don't think that's clear. And before we move forward with a plan, we need to understand that. So maybe again, it's not one plan versus the other, but neither of these plans is completely fully vetted. So let's stop making about one plan versus the other. Let's make it about build the right plan for every single one of you in this room.
If I remember the question, it was, how can we operate the ambulance service without mill levy taxes? And I don't know the answer to that. I think we have to have taxes to operate the ambulance service. Last year, the county commissioners voted to help the hospital with the ambulance service to the tune of $250,000. That agreement runs out in December of 2015. So after 2015, there's nothing to support the ambulance service. I want to clear up a misconception. I've seen or read that the county has money in the budget to support an ambulance service beyond 2015. That's simply not true. There's nothing in our budget for ambulance service. The formation of a special district is a possibility. Special districts come with taxes. And I would be surprised if we could operate an ambulance service, the county operated ambulance service, for less than $750,000. So I think the ballot question 1A is a fair question for you to decide whether you want ambulance service in Lake County or not.
With the time that we have remaining, I believe I'd like to respond that I answered the question to the county commissioners 2 months ago, a complete analysis, dollar by dollar, every service we were collecting with EMS services. I had a stack of bills, every number on the page could be audited. I provided that complete analysis, payroll information, account by account, bill by bill, employee by employee. I submitted that information to the county commissioners, and it was reviewed by Ken Vershalik and made available in every way I could to make it open to the public. There was no question about how much EMS services cost.
Okay, we're down to the last two questions, one for each side. Question for Sam Centura. Does your St. Vincent plan depend on getting a grant, such as from DOLA? And if yes, what happens if you or we do not get that grant to the fulfillment and success of your plan?
The numbers that I have presented in the 5-year pro forma and that I submitted to USDA do not include any fund proceeds from the state DOLA. We received the funds last year, and I believe that we might be on the inside track for getting a grant next year. Because it's an unknown, and because we're not certain to get that, I have not considered that in our pro forma. If we did that, if we received the $2 million grant that I would hope we would get, it would reduce our debt service by 20%. But that would be a more favorable presentation than what we've done. I presented the numbers to USDA and to the board and to Centura as conservatively as I possibly could. The impact of the DOLA would be favorable to what I presented.
Again, those performance, we believe Centura has a lot of experience in the hospital business and some very smart people working for them. However, in those performance, they still did not take into account the mine by proceeds. That's an incredibly variable piece of this puzzle, and I think to try to say that the performance now look good would be mistaken, because we still don't understand what that mine by proceeds number may look like if moly prices continue to fall, if metal markets continue to fall, if the worldwide markets continue to be unstable. So I think that we still do not have a good understanding of what that is. It's only been in the last 5 days that we've had that explanation and those conversations with Sam and Russ. So again, keep looking at this. This is important. The other important piece of this is that over the last couple of years, there's been an increase to the county alone budget of $3.5 million additional revenue to the county budget due to Climax Mine. Again, that's an incredibly variable number.
Okay, and last question. for the Better Plan for Lake County. Specifically, who are your partners for this alternative plan?
Again, it's about building the plan together. I would hope that the partners are Centura, St. Vincent, Rocky Mountain Family Practice, and this community with all of the expertise and knowledge that this community has. We've got EMS providers, we've got lots of expertise in this community that really have not come to the table, and I think it needs to be much more collaborative, more cohesive. Climax is willing to pay for feasibilities or mediators or someone to bring those entities together, someone who doesn't have a financial gain in it, someone who could just come together and say, you all get a say in what this plan looks like, and we all get to decide not necessarily what we all want, but what we all need and what will help sustain us to either get us to where we need to be or stabilize us while we're here.
All right, and that rounds up the question and answer session. Again, clearly not everybody got their questions answered. I have 2 in my hand and there's more on the table back there. At the end of the evening, we'll split the room up so that you can speak with the side you would like to ask questions of. So it's now time for closing statements, and I'll ask for Save St. Vincent Hometown Healthcare to begin.
Thank you. To clarify a couple points that were made earlier, what Centura has tried to do, even in the last 10 days, is to keep the discussion going with the mind, understanding what their complications are and understanding what the ramifications are of Molly prices. We've tried to suggest options that would reduce their mills in the coming months, as well as all you taxpayers in the room. Realize it's the 11th hour, but we've been continuing those discussions, as I would want to do in the future. You have a choice that you'll make on November 3rd. Choose between a campus on the hill or an idea that likely means fewer services. Choose between a business plan that's vetted with various stakeholders or a plan that is still in process. Choose between the level of services and care that you already trust or with an unknown entity that we're not certain of and may mean fewer resources. Choose between a known mill increase that we can identify through plans that we've already done and projections versus a plan where there is an undetermined mill levy from an organization that maybe isn't formed yet. You have the choice and the decision is yours. What we're asking for is we, Centura, are willing to provide services for you wherever you choose. We will provide those services in Lakewood, in Frisco. Preferably, we would be providing them here where you need them most in that golden hour.
So I just want to remind you of a couple of quick things. I came here in 2008, and I was hired to educate the community about sustainability so that they didn't fall into the same trap they did in the 1980s. And in 2008, we paid about $400,000 in taxes. Last year, we paid $9.2 million in taxes. So there's been an increase in taxes, obviously, and you all have the windfall from those taxes. We've said all along since 2008, please invest the taxes that we're paying wisely for your future, but don't put all of your eggs in one basket. Diversify your economy. Think about every small business in this community. Think about the impact that every mill levy increase has on all those small businesses. And again, if we take the premise that this is the right plan and Centura is the right partner, we still have to be able to pay for the right plan. And I'm not sure we're there yet. This is a very variable market, and we need to be very, very conscious about that. So when you think about those taxes that are there one day and not there the next day, remember that you can't build a plan on something that isn't going to be there every single year. It's not the same as residential taxes. It's almost the same as the argument about sales tax when we say, well, sales tax wouldn't be a very good way to fund this because that's variable. It's going to go up and down every year. Mining goes up and down every year. 41% of the increase in revenues that's being proposed is coming from Climax Mine. We want to be a partner. We want to pay our part. We want to be part of the solution for everything that happens in Lake County. This may not be the way to go about it. We've got 400 employees. We want to protect those jobs of those 400 employees. Over half of those employees live here in Lake County. They eat here, they buy things here, they pay for services here, and they get paychecks from the mining industry. We want to make sure that every tax increase that happens to our industry doesn't put in jeopardy those 400 jobs that are up there on the hill. Again, let's take some time and turn this into the best news, an example of community, public, and private collaboration, Colorado in the nation, collaboration in the nation, and make sure that we're doing the right thing for each and every one of you. I don't want to see any of you strapped with something that in 2 or 3 years falls apart, or in 20 years falls apart. We open mines for the sole purpose of closing them. This mine will close again. Please don't become dependent on dollars that may or may not be there in the future. Let's build a plan that works. Let's work together. Let's care about each other. And on November 4th, let's just figure out what we're going to do. Climax will stay at the table regardless of the outcome of this election. We'll stay engaged with every community development activity that happens, and we'll stay engaged with you each professionally and personally.
All right, well, thank you to our panelists, to the Chamber Board for the hard work they did tonight, for Lake County Build a Generation for providing childcare, and CMC for providing the room.